Hello, welcome. I am Laurie Trungone, the service line leader for Women's and Children at Inspira Health Network. Our presentation today is brought to you on behalf of the Spirit of Women program that we have here at Inspira. This program allows us to bring you timely topics with information that you can use, and hopefully you'll have some fun while learning. The purpose of today's program is to provide an overview of vascular health and recommendations on how we can keep ourselves as safe as possible through some vascular screenings. This presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified health provider with any questions you might have regarding a medical condition. Remember, today we cannot hear or see you. The only audio and video that is turned on right now is by our panelists. On your screen, you will see a box labeled Q&A. Feel free to submit your questions throughout the presentation and we'll address them at the end. Your questions will only be visible to us, so if you'd like to keep your identity anonymous, you can do that by just checking the box anonymous, but even if you do that, we're the only one, or don't do that, we're the only ones who can see the questions. So feel free to ask anything that's on your mind. Throughout the presentation today, we will have some poll questions pop up on your screen. We just want to see kind of where you are, what you know, and where we need to head. You will receive an email after the presentation, as this is being recorded. And today I'd like to introduce our speaker, Dr. Holly Graves. She is a vascular surgeon who participates at Inspira Medical Group's Surgical Associates in Vineland. She's originally from Michigan and attended the University of Michigan and then medical school at Columbia College of Physicians and Surgeons. She completed her residency at the Hospital of the University of Pennsylvania. She's board certified in both vascular surgery and general surgery. She provides a full range of vascular surgical services and procedures, including endovascular and open surgical arterial interventions for peripheral artery disease, limb salvage, as well as aortic disease, carotid procedures, venous ablations, and wound care. Dr. Graves was named a South Jersey Top Doc in 2019, and we're very proud to have her as a member of our Inspira Medical Group team of physicians and providers. So welcome, Dr. Graves.
Thank you very much for having me today.
So all of us have heard about arteries and veins, right? So Dr. Graves, can you help explain to us what the arteries and veins are and what they do for us in our bodies?
Sure. So arteries basically bring the blood from the heart down to the foot. So they are the passageway to supply the oxygen to the tissues. The veins are the conduit that brings the blood from the foot back up to the heart. So you can see here on your left shows the major blood vessels that I treat. So the aorta is the main blood vessel that starts from the top of your heart and goes down into your belly. It then branches into the iliac arteries, which are in your pelvis, and then they are branched down into the main veins of the thighs and in the calves. Normally in the thigh, there's two main blood vessels that have multiple smaller branches, and in the normal calf, there's three blood vessels that feed down into the foot. The veins are divided into the superficial veins and the deep veins. So oftentimes you'll hear about, Eliquis for treatment of DVT or deep vein thrombosis. So the deep veins are the veins that we don't want blood clots in. The superficial veins, though they can form blood clots, are usually less serious. The superficial veins are the veins that can lead to venous hypertension or venous reflux when the blood flows in the wrong direction. These are the veins that can be treated surgically with the ablation procedure and also surgically removed. These superficial veins can also be used for coronary artery bypass grafting or CABGs with the cardiac surgeons. And they can also be used, by the vascular surgeons for open arterial bypasses.
So when we talk about healthcare and issues related to our bodies, we hear about issues related to our arteries or veins or the vascular system, as you just described for us. Can you tell us what some of those problems can be, or more specifically, what the vascular system means?
So vascular disease can include, again, the arteries. The arteries bring the blood to the foot, or the veins. The veins bring the blood back up. So these problems can be annoying or painful, and they can be as life-threatening as death. The blood vessels are everywhere. They're in your head, they're in your chest, they're in your belly, they're in your legs, they're in your feet. So vascular disease can encompass the entire body. When we're talking about peripheral arterial disease, the most common thing we're talking about is narrowings or blockages leading to decreased blood flow to the targets, such as the foot or the intestines or the brain.
Sorry about that. Are there symptoms of vascular problems that we can be aware of?
Sure. So depending on where your narrowing or blockages may be, you can have pain in the hips, the thighs, the buttocks, or the calves, and the feet. So if you had a blockage up top, in the blood vessels in your pelvis, you'd most likely feel it in the buttocks and the thighs. If the blockage was in the thigh, you'd most likely feel it in the calves. Cramping can occur with many, many different different etiologies. It can be from electrolyte abnormalities, it can be from blood vessel disease. So, I don't want patients, getting very scared if they have cramps, because it's not necessarily vascular disease. Sometimes patients describe, I feel weak after walking a couple blocks, or my foot gets numb after walking a couple blocks. But again, numbness can be related to diabetes. It can be related to neuropathy of many different etiologies. Coldness in the foot. A lot of people have cold feet. I have cold feet. I'm always cold. So it doesn't necessarily mean you have vascular disease, but as vascular disease progresses, patients can notice, hey, my right foot's a lot cooler than my left. If you have cuts or wounds on your feet that don't heal, that's a sign that there's a problem. And one of the most common problems is, problems with the arteries or problems with the veins. Oftentimes, both in arterial and venous disease, you can see discoloration of the foot or the legs. With venous disease, the legs will turn brown around the area of the ankles. With bad arterial disease, oftentimes the foot will turn purplish or almost a mottled red color. People can lose hair when there's a lack of blood flow. But again, some people lose hair independent of arterial disease. Toenails can be discolored. They can, stop growing. They can fall off. Shiny skin on the legs, that can be seen with both arterial and venous disease. You may notice yourself that you're feeling the pulse in your wrist, or you're feeling the pulse in your foot, and you notice one stronger than the other. I mean, that's a sign that there's a differential in blood flow.
So what, everyone's fear is usually, what if things get worse? How can we tell if the disease is progressing?
So a lot of people have blockages that are just incidentally found. When you screen people, you're going to find narrowings and you're going to find blockages. But really, if you're not having many symptoms from it, it's not something to worry about acutely. It's something to keep an eye on over time. But the key points are realizing when the blockages or narrowings that you may have are getting to a critical point. So if you notice, a few months ago, you were able to walk to, around the grocery store and you were fine. But now all of a sudden, over the past couple of weeks, you can walk down the aisle and you got to stop because your leg hurts so bad. I mean, that's a sign that something's worsening. Pain when you're just sitting there is a sign of significant vascular disease. Patients often say when they go to bed, since their feet are not in the dependent position, that they can develop worsening leg pain. Patients will often say, I woke up horrible calf pain and I had to drop my foot off the side of the bed. And then once the foot's in the dependent position, it promotes blood flow. So that's a sign that, the arterial vascular disease can be worsening. Again, pain that's waking you up from sleep is not right. Like we talked about, hanging the legs over the bed is a classic finding of worsening arterial disease. And when you do have these symptoms, even though they may not be related to arterial disease, you can't just blame it on the fact that, oh, I'm getting old. I mean, something's clearly not right. So whether it be related to your nerves, whether it be related to your diabetes, whether it be related to your arteries, your veins, your back, it's important to find out what's going on, because that way, the earlier you find out what's going on, the sooner, we can both correct the problem and help to make you feel better. So again, whether you want to reach out to a vascular surgeon right away or start with your primary care doctor, it doesn't matter. As long as you reach a physician, they'll be able to point you in the right direction. And that, oftentimes I'll see patients where I say, hey, your leg pain is likely related to your back. So I send them to a neurologist, I send them to a neurosurgeon. So, even the vascular surgeons, when it's not necessarily, an artery or vein problem, can lead you in the proper direction.
So as part of Spirit of Women and in Spirit in general, we do a lot about screenings and trying to make sure that people help prevent issues from either getting too far out of control or knowing them in the beginning. We want to know if there's a problem. So what are the guidelines for screening?
So, of course, age is a risk factor for a lot of medical problems. So, and I think these guidelines will change over time just because people are living a lot longer. So, oftentimes people say age over 65 is when you should start being screened for, aneurysmal disease or abnormal enlargement of the blood vessels, or, just looking at the blood vessels in the neck to, trying to reduce the risk of a stroke, or the arteries in the legs. If you have other significant risk factors, significant high blood pressure, hyperlipidemia, diabetes especially, and if you smoke, that makes your body a lot older really quickly. So particularly smoking, so that, patients over 50 with those combined risk factors. And even patients, that have had diabetes for a very long time and have other risk factors. They've had high blood pressure since they were 20, obesity. When patients have a lot of risk factors, age shouldn't necessarily be the guiding factor. The bottom line is, if you're concerned, screening tests are readily available. And they're usually, they're non-invasive. It's not like poking needles in you or anything like that. They're not painful. And again, they're easily accessible. And that way you can get a baseline of kind of what's going on inside your body.
So now that people know kind of the guidelines of screening, can you tell us what are the causes of peripheral artery disease?
Sure. So atherosclerosis basically means that the walls of the blood vessel accumulate quote unquote junk. So by smoking, by uncontrolled diabetes, obesity, high blood pressure, high cholesterol, it can be genetic. There's various genetic factors that can contribute to this. All these factors can lead to narrowings and blockages of the blood vessels. And, sometimes we never figure it out. Sometimes there's patients that have never been a smoker, don't have a family history, and for whatever reason they get it. We don't know all the genetics at this point in time. So, there are people that are known to be at increased risk, but, anyone can develop blood vessel disease.
So as with any issues related to our bodies, when there's something outside of what is considered normal, there are often complications associated with that. So what are the complications associated with peripheral artery disease?
Okay. So with peripheral artery disease, again, it's decreased blood flow to various parts of the body. So when you don't have blood flow, you can't heal. So oftentimes patients will have wounds that they have a hard time healing. Again, pain with walking or pain at rest can be related to blood vessel disease. But the main thing is realizing that if you have a problem, let's say in your legs, you're at increased risk of having the same problem in all the other arterial beds in the body. So I always, will screen my patient with a total vascular screen. If they have a significant narrowing in their leg, I look at the main blood vessel in the belly, make sure it's not abnormally large. I send them to a cardiologist, because just like the blood vessels in your legs can get blocked, so can the blood vessels in your heart. When that happens, you can have a heart attack. If the blood vessels in the neck are narrowed, you're at risk of a stroke.
So what are the tests to help diagnose peripheral vascular disease so that people know if they have an issue or not?
So the first thing to start with is a physical exam. You always want to look at the patient head to toe. What is their weight? Do they have malnutrition? Are they able to walk? Are they wheelchair bound? Are they alert and oriented? Or are they demented? Do they live in a nursing home? All those things come into consideration. And then just looking at, feeling for the pulses, listening over the arteries. Is there an abnormal sound over the arteries? Just a basic head to toe physical exam can oftentimes, give subtle hints of, this person may have a vascular issue. Ultrasound. So, just like, in pregnant women, when they take the magic wand with the goo and the gel and just rub it everywhere. So you can look at the blood vessels in this way. You can look at the blood vessels of the neck. You can look at the blood vessels of the legs. You can look at the blood vessels of the belly. And again, this is a non-invasive, non-painful way of getting an idea of what's going on with the blood flow. There are blood tests that you can get, to look at the patient's hemoglobin A1C. It gives you an idea of what the blood sugars have been over, the past, several months, past several weeks. You can also check cholesterol levels. There are certain genetic tests that can be done, just to also, keep an eye on things over time. So if you realize your hemoglobin A1C is 9, obviously that's not good, and you want to make it a goal to get the hemoglobin A1C lowered. The ankle brachial index, which I think we have another slide showing a picture of that, basically compares the blood pressure in your arm to the blood pressure at your ankle. And there's various ranges that can estimate the degree of how much blood flow you're getting to your leg, and it can also give us an idea of where exactly an idea of where the blockages are, the narrowings are. These, the ultrasound and the ankle brachial index, these tests aren't perfect, but again, it's a screening way, non-invasive way to look at the body. Angiography is a little bit more invasive. It does involve, putting what I tell my patients, a big IV in the artery, and we take pictures of the arteries. We can do, take pictures of the main blood vessel in the belly, the aorta. We can take pictures of the blood vessels on the neck as well as the legs. And this does use IV contrast, which also is a concern for patients with renal disease. So this is the arterial Doppler. So when I can't feel the pulses in my patient's feet, you can listen to them. By listening to them, it's something you kind of learn over time. You can tell how bad a blockage is. And you can also get an idea of, is the blood vessel completely blocked, or is the patient getting flow to this area? This is what we had been talking about, the ankle brachial index. So basically you're comparing the blood flow or the pressure of the artery in the arm to the pressure of the artery in the foot. So normal ABI is greater than 0.9. They say that if it's greater than 1.3, that, there's concern that the blood vessels have collected calcium over the years, which can happen with age, or particularly diabetes or renal failure. And you can see that, between 0.4 and 0.9 is this kind of a range of how bad the peripheral arterial disease is. ABI of less than 0.2, usually we get pretty concerned that they're getting to the point where it's critical disease or very bad blockages. But again, I have patients that are walking around with an ABI of 0.4 that are completely fine and don't have any symptoms at all. So, the important take-home message here is, don't just look at the number. If you were to get a screening test and, they said your ABI is 0.7, don't panic. Because again, you got to take into consideration the person, not just a number given to the person.
Right. So let's ask our audience a question. Is peripheral vascular disease curable? So we'll let the poll question come up, true or false. Is peripheral vascular disease curable? So we'll give you a second to answer that, and then we'll let Dr. Graves tell us if you're correct and if there are or aren't any treatment options. So let's see. So 88% of you believe that peripheral vascular disease is curable. So Dr. Graves, you want to let us know if that is in fact true?
Well, I think you're both right. So, if someone has a blockage in their leg, can I open it up with a balloon or a stent? Yes. So theoretically, is that cured? That blockage is cured, but is your total body peripheral arterial disease cured? No, because you still have those same risk factors everywhere else. And the thing is even if I balloon or stent your artery, it can it can happen again over time. That artery can narrow down, the stent can narrow down, especially if the risk factors aren't modified. If you keep smoking, that stent's going to clog up. So again, at one point in time, it can be made better. But again, I don't think that peripheral arterial disease is truly curable. It's a lifelong thing. And I tell my patients, once you meet me, we're friends for life, because I watch my patients and monitor my patients for life.
So how about some other treatment options?
So we always encourage a healthy diet, weight loss, exercise, something called a walking program, where we encourage patients at least 3 times a week to walk 20 to 30 minutes. It doesn't have to be power walking, you don't have to be running marathons, but basically when you walk and you promote exercise, the body makes collaterals, or the body makes new blood vessels to circumvent the narrowings or the blockages that currently exist. There are medications, keep blood pressure medications to keep your blood pressure down, aspirin and Plavix, things that thin out the blood a little bit. There's also blood thinners such as Coumadin, Eliquis, Xarelto that completely thin the blood. Statins are a major medication that we use. They're mostly used to treat cholesterol, but the other important thing they do is decrease the inflammation of the blood vessels. So even my patients with normal cholesterol, I have them on a statin. And in acute situations, we actually have medications that can dissolve blood clots. We have endovascular, minimally invasive things where we use the balloon and the stents, and then we have the traditional open surgical procedures where we operate directly on the blood vessels. So we have various forms of balloon treatment. We have regular balloons that don't have any form of drug on them. We also have drug-eluting balloons. We have drug-eluting stents. And this just basically gives you an idea of there's the on the left, you see that there's the narrowing in the blood vessel. And then over a wire, we're able to take a deflated balloon and blow it up in the artery and take it out. So, we don't take anything out of you. We don't leave anything in you with the balloons. Stents, so there's various forms of stents. They can be bare metal where it almost looks like a cage. It can be a stent with drug on it. So the point of the drug is to help increase the patency of the stent, or with the balloon, increase the patency of the angioplasty. And then we also have special stents that have a fabric over them that we use in certain parts of the body. And anyone that has a stent, I have them on at least aspirin, but most patients, especially with the drug-coated balloons, as well as the stents with the fabric on them, I have them on Plavix as well, at least for 3 to 6 months. The Rotorooter. So this is a particularly kind of cool thing that we can do in vascular surgery. It's basically a machine that chips away at the calcium. When the blockages get real bad, it's like a cement wall. And this device, we can actually eat through the cement in the artery.
Wow, that's amazing. I know I've heard about bypasses, and people who've had bypasses both in my family and just in the general public. Can you explain a little bit about what that is?
Sure. So not all blockages can be opened up with a balloon or a stent. When blockages have been there forever, sometimes you just can't blast through them with no matter what new technology you have. Also, sometimes it's just better for the patient to do a bypass. In a younger patient that has a very long blockage, sometimes it's better just to do a bypass because the patency rates can be better. So one of the most common bypasses we do is in the leg, where we, bypass from the groin down to the knee area, either above the knee or below the knee, but you can bypass all the way from the groin down to the foot. So they can be various lengths. You can use your own vein, like we talked about in the beginning of the talk, those superficial veins. You can use a graft with just basically a piece of material that allows blood flow to flow through it. And also cryopreserved veins. So someone that's passed that has donated their vein to use for a bypass. The cryopreserved veins don't last as long. Obviously, the best choice, if you can, is using the superficial vein, but not everyone has big enough veins to use.
So I know I personally have heard, you are what you eat. Let's ask our audience a poll question. Again, are there specific foods that promote vascular health? True or false? There are specific foods that can promote vascular health. So if you eat well, you should be relatively healthy, essentially. And if not, then you're going to have issues. Let's see what you all think. And then we will have Dr. Graves tell us. Good for you. 100% think that, yes, there are specific foods that can help promote vascular health. So we'll have Dr. Graves sort of just briefly go over what that means.
So I will preface this with, if you are really concerned about your diet and you really want to get involved in weight loss and a healthy weight loss program, we do have nutritional services here. So, you would be able to schedule an appointment to meet with a nutritional therapist. I am not a nutritionist, but there are certain foods. Salmon is known to be very healthy just because of the unsaturated fatty acids, omega-3. Olive oil, and try to use olive oil instead of butter per se. Oats, spinach, vegetables, and so forth. And again, the nutritionist can give you a lot more information.
Okay, and we will have the number for the nutrition counselor here at Inspira on the last slide when we go over our questions and answer. But, there's the saying that prevention is the best medicine. Again, that's what we promote all the time here at Inspira. So is that true here as well? Are there things that we can be doing to help prevent some of these vascular disease issues?
Yes, the main thing is quit smoking. I know it's hard. I've heard it from all my patients, but even if you've been smoking for 50 years, to stop smoking today will make a huge difference in your life, both in terms of your lungs, being able to breathe, your risk of cancer, your ability to heal. Smokers oftentimes have a very hard time healing anything, even if surgeries, wounds, and in some practices, such as orthopedic surgery, some surgeons will not operate on you if you're smoking. And that also is true with vascular surgery. There's certain procedures, if you're smoking, we would not do it. So again, stopping smoking, just doing your best, even cutting down, it makes a big difference. If you're diabetic, get involved with an endocrinologist. You really want your blood sugars to be well controlled. Diabetic patients can develop neuropathies, and when you can't feel your feet, you're prone to forming wounds. And even if you have great blood flow, if your sugars aren't controlled, you're not going to heal. Regular exercise, keep your body active. Again, like we talked about, if you do have, narrowings in your blood vessels, exercising helps your body make new blood vessels. Keep your cholesterol levels under control. Follow with your primary care doctor. Identify these things early. You don't have to be 50 years old to go to a primary care doctor. Even people in their 20s and 30s should be keeping an eye on these things, because you can develop high cholesterol even at an early age. We talked about, eating healthy foods, and if you're concerned about what you're eating or what are the best foods, contact a nutritionist, and maintaining a healthy weight.
So let's now take some time for some questions from our audience, and we do have some in the queue here. Does sitting for long periods of time hurt my blood vessels?
Sitting for a long period of time doesn't hurt your blood vessels. A lot of people have that preconceived notion of, if I cross my legs, am I going to give myself vein disease? No, but again, just getting up, moving around, keeping the blood moving, especially in vein disease, being static or, sitting for long periods of time does put you at risk for blood clots. So even getting up, walking around, I'm not telling everyone you have to go run a marathon every day, but just, one or a couple times a week, try to walk around the block with a friend, go walk the mall, try to just get out and about, exercise equipment at home, try to get back in the gym if you can. And again, it doesn't have to be a crazy workout, just moving is good.
So you just mentioned about crossing your legs. So crossing your legs doesn't really cause, everybody says that causes, varicose veins. So it doesn't really do that?
I don't think it's been proven.
Okay. Wow. That's good to know. And how about the exercise and the walking? Does it need to be 30 minutes consistently, or can it be broken up to say that I've done 30 minutes throughout the day?
The traditional, walking program is 30 minutes 3 times a week, but again, we got to be realistic, and so I tell my patients, I'd rather have you doing something than nothing at all. There also is a cardiovascular walking program that's supervised at the hospital. So it's a very structured program. They have a very specific protocol, and it's monitored, and you're in the hospital. So if something happens, heaven forbid you start getting short of breath or you have chest pain, you're in the hospital. So that's an excellent resource. And your primary care would definitely be able to get you, and as well as me, would be able to get you connected with that program.
So another question is, the back of my knee, that soft area in the back of this person's knee was black and blue one morning for seemingly no reason, and it was uncomfortable. She wants to know if she should have been checked or what that might mean.
Well, people, you can have muscle tears, you can strain a muscle. Sometimes for whatever reason, a vein can pop. It's not necessarily, I don't know what exactly happened or why that happened. If you're concerned, you can always get an ultrasound in your leg. Your primary care doctor could easily order that.
Right. And how about, I'm not sure if you know the answer to this, but do most insurances cover the nutritionist, cardiovascular walking, and those types of programs?
They should. The walking program, especially, that's a well-known treatment of arterial disease. Different insurance companies can be finicky, but also, Inspira has resources to kind of help combat that. So if it's something you really want to do and there's an issue with insurance, there's ways around that.
Right, right. And then I know you did address in the presentation that cold hands and feet don't necessarily mean poor circulation. That was another question that we had out there.
No.
So I would like to thank you, Dr. Graves. We're at the 12:30 mark for educating us today on why vascular health and vascular screenings matter. We really appreciate it. We have behind us a number of people to help put these programs on. Our Relevate team from the Spirit of Women who are present with us today and often are, as well as Lauren and Suze, who always help us put these programs on. I do hope you all have a better understanding of arterial disease and how screenings are important for your overall health and well-being. As you know, we want you to stay safe. Thank you for participating with us today. And Dr. Graves, do you have any parting words?
Thank you very much. If you're at all concerned about anything, I'm happy to see anyone for anything. So any concerns, feel free to give my office a call. I can get you in very, pretty quickly. It's not like, certain specialists where it takes 6 months to see me. I mean, I can get you in 1 to 2 weeks. So if you're at all concerned, the best, advice is just have it checked out.
Yeah, and I can speak from personal experience. You helped my dad, got in right away, and it was a very good experience. So thank you very much for joining us today.
Thank you.